Hi guys, welcome back to my YouTube channel, Hope Beyond Brokenness. Thank you for your support. Thank you for sharing. Thank you for commenting. Thank you for viewing my videos. Thank you for liking. Please keep at it. Support your girl. My name is Joyce and welcome to my channel. Today I'm just here briefly to speak about addiction. This is something that is almost becoming a pandemic because everyone is using drugs. There's a report from Nakada that now people are using animal drugs as drugs. Oh no, oh no, mercy. So it's becoming an extreme, and it's going to the extreme, and it's very sad. So I'm just here to briefly speak about addiction. I'm just here to encourage you that addiction does not happen in one day. It's dangerous. There are steps that people go through before they get addicted. And if you have a child, if you have a sister, a brother, or someone that needs to see this video before they get hooked, before they even try, please send it to them. So what is addiction? Addiction is a chronic brain relapsing disease. It's a chronic brain relapsing disease. It's a chronic relapsing brain disease. Either way, this means that it's a disease. It's an illness. It's like cancer. It's like AIDS. That's why there's relapsing. People will go through even rehab. They go into the rehab, but they still relapse because once it gets to the brain, it's hard to break free. So, and people don't get addicted, as I've said, in one day. It's a stage. There are stages. So there are 5 stages of addiction. Number 1, experimentation. Most young people just experiment. Some friend comes and tells you, "Oh, have you ever tried bang? It makes you feel high. It makes you forget things. It makes you concentrate in school. You can try it." Then you experiment. You go to a party and everyone is drinking and you feel odd. You want to fit in. Why not try? You're told, try it. Stop being a fool. Try it. You try it. You start it's very, when you start, it's very innocent. It's like, just one day, so it's not bad. Then now you go now to the regular use. Once you've experimented and maybe you felt the high that they tell you feel when you take the drug, you said, "Well, I think now I can do it." So you now get your regular as maybe in a week you take twice or thrice. You have to smoke bang. It becomes now regular, something that you used not to do at all. Now you start doing it. You have to take some drink before you sleep, or before you start working. So you go to the regular use. The people call it, many people say, "I'm a casual drinker." I'm just a casual drinker. I just drink on weekends. So that's now regular use. And then now you go to the problem and risk-taking use. So now the user's life becomes affected by their use. So if you take drugs, you can't even be productive at work. You cannot even sustain being at work without smoking. So every time you have to excuse yourself, you're high, you can't be productive. Or you've drunk, you're smelling alcohol, your colleagues are tired of you, you're not delivering as supposed. Now this drug starts, it's now creates problem in your life. It can create problems in your relationship because you go out, you drink, you cheat because maybe your wife is at home. It's just the drugs cause problems because you're not in your right senses or right minds. You do stupid things, you decide, and you're not, it just affects your life. Now you have gone to the problem and risk taking. Some even drink and drive. You take risks because now it's like, I don't care. Then now you go to the dependency stage. Once you get to the dependency stage, now the brain has now chooses to adjust to the chronic use and withdrawal starts to occur. Now this is the stage that you cannot do without it because there are withdrawals. There are withdrawal symptoms. Some people, have you seen people who maybe when they don't take a shot, they don't take alcohol, they shake. You see, you have become dependent on this drug that you cannot use it in any way. You cannot, I mean, you cannot not use it. You know, it now becomes bad. And you know, in this stage, surprisingly, people are in denial. Other people notice that, Charlie, this thing is not doing you good. But when you ask them, they are in denial. They're like, hey, please, I'm very, very okay. Have you ever seen people saying they're staggering, falling, and they say, please, niacheni niko sawa. See, they're in denial. They don't want to admit that they have a problem to get help. And yet, we can see clearly that it's affecting them. So because of this denial, they get into now addiction stage. Now this is a stage that it's a very hard stage to come out of. You are hooked. You know, even if you go to rehab, the brain has already, it's so used to this. You cannot survive without, you know. So now you become a burden to your family because you have to spend money to take you to be taken to the hospital, spend money for drugs. If you're the sole provider in the family, you cannot work because no one is going to employ you. It becomes now an issue. And this is a stage that most people actually get depressed because you start to feel like a burden, and people even start to avoid you because when a friend sees your call, they know this one, they want money, they want mchango. So it's bad. What am I trying to say? If you can avoid. You do not need to walk some through paths to experience things. Some you learn by observation, and you learn. And you know, it does not always happen in this linear stage, as in from experimentation to no. It's different for everyone because there are the predisposing factors. There are people who get hooked by the day they first try, they get hooked. And there are drugs that are very addictive, like like opioids, heroin. Very, very addictive. So why is it that it's different? Why is it that some people just take the drug today, they're hooked. Others take for years. They are never even hooked because there's something called, there are people whose genes have these drugs. You know, like maybe your grandparents used to take drugs, your father. So you see, for you, when you just take it once, it's easy for you to get it because there's that predisposing factor of genes. In your family line, there's a history of alcoholism. So you can never really know. You can never really know where you're going to get hooked. You cannot compare. You cannot say, this one did not get addicted, but our paths are different. So if you're a young child there, if you're a young person, if you're a youth, please avoid drugs. Avoid drugs. You know, drugs interrupt the reward system in the brain. It changes the way the brain perceives pleasure. So as you keep taking drugs, there's no any other way that you're going to be happy unless you take drugs because you're so dependent on them. There are healthier ways to be happy. There are healthier ways to experience pleasure other than drugs. So this is just a small psychoeducation. Did I say a disclaimer? It is not a therapy session. It's just a psychoeducation. You cannot rely only on this information to treat your client or if someone already is in these processes, you cannot just use this information. You have to see a therapist because once you get to the addiction part, it becomes hard. Addiction is a disease. Prayer is important, of course. Prayer helps. But you see, it's a brain disease. You need medicine. You need to be treated. You need a lot of things to work together for you to come out. Yes. So it's just a short counseling, short advice, wherever you will call it. But if you see some young ones engaging in drugs carelessly, thinking that they are safe, thinking that there are many myths when you take, especially the myths of bang. I will talk about it very soon. The myths of bang, that bang is helpful. Why do prominent people take them? Kina Snoopy Dogg, kina Wiz Khalifa. So people now, young ones are encouraging themselves that is appropriate. it is not appropriate. Please, you have to get your facts right. You have to research, and you have to understand it's very, very different. Very different. You have to get your facts. There are also medicinal. There are some bang that is medicinal. I will not call it bang. I will call it just cannabis. You see, that has medicinal nature in it. It's made in the lab. It does not have this thing that makes it, a drug effect. So you know what? Just get what you can get, but the most important thing you should know is it is bad. So say no to drugs. Have a lovely, lovely time. See you in the next video. I don't know, maybe I should talk about the bang myths. Anyway, thank you.